Introduction to Holter Monitoring, Lecture 2.1. The Holter monitor is a portable ambulatory monitoring system that records the electrical activity of the heart for typically at least 24 hours, but it could also be 48 hours or even longer than that. It depends on the type of monitor. And it can detect cardiac abnormalities. It can also detect the absence of cardiac abnormalities, which can be very important in ruling out certain diagnoses. And these can occur while the patient is engaged in normal daily routine. And the monitor is designed so that the patient is able to maintain daily activities with minimal inconveniences. So it's similar to a resting EKG in that the electrical impulses given off by the heart are picked up by electrodes and transmitted through lead wires to a recording device. But it's different than a resting EKG because with a resting EKG, only about 10 seconds of the heart's activity is recorded. So it's a very quick and brief snapshot. And the Holter monitor records the heartbeat continuously for an extended period of time. So you can catch a lot more and get a lot more information from a Holter monitor. They are typically lightweight and battery powered and can be clipped onto a belt around the waist, such as this gentleman here, or hung with a strap around the patient's neck, or they can wear it like a purse. And it usually is set with a timer and automatically stops recording after the monitoring period is completed. So depending on what the provider ordered, it might shut off at 24 hours or 48 hours. Or we'll look at some at the end of here that are actually wireless and look like Band-Aids, and you leave them on for as long as they'll stick on. So sometimes 10 to 14 days. And these are used to diagnose cardiac rate, rhythm, and conduction abnormalities, most frequently to assess the rate and rhythm of the heart during daily activities. They can evaluate unexplained chest pain, dizziness, or syncopal episodes, and discover arrhythmias that are not picked up on a routine 12-lead EKG, because a Holter can record approximately 100,000 heartbeats in a 24-hour period. So it's a lot more information. They can detect myocardial ischemia, and assess the effectiveness of medications, especially antiarrhythmic medications. Oftentimes, medical offices will have their own Holter monitors that the MA will be responsible for preparing the patient, applying and removing the monitor, and instructing the patient in the preparation requirements and the guidelines to follow while they are wearing the monitor. So you're going to make sure you let the patient know, usually before they come in to have the Holter monitor placed, that they should bathe or shower right before, because they will not be able to until they're done wearing the monitor. So if it's a 24-hour, that's not usually that big of a deal. But if it's going to be one they're going to have on for 48 hours, they usually would like to bathe right before. It's very important that they don't apply lotion, oil, or powder to their chest before or during the test, because that'll make it very difficult to apply the electrodes and for them to stay on. Unless the physician specifies otherwise, they should take all their normal medications at their usual time. And they should wear loose, comfortable clothing. A shirt or a blouse that buttons up and down the front is very helpful for applying the electrodes and then just rebuttoning over the leads and the electrodes. This gives it a much easier application, and it can also prevent the electrodes from rubbing against clothing and becoming loose and coming off. The electrodes are different from the ones we use for the 12 lead for the resting EKG. They're usually thicker and they have foam in them, and they have an adhesive backing, and they are often round or rectangular in shape, and they have an electrode plate and a snap that attaches to the lead wire, and then a central sponge pad that contains the electrolyte gel. And these are disposable, discard after you use them. So here's the electrode snap on this one, and on the other side is the adhesive backing with the sponge pad saturated with an electrolyte to enhance impulse transmission. And here's another picture of it with the electrode plate, which is metal, the sponge pad, and the adhesive backing. Some of the newer Holter monitors use 4 to 7 electrodes, depending on the brand, and these are placed at various locations on the chest. And depending on the number of electrodes and location, there should be a diagram inside the operating manual and on a placement chart. And so each brand of monitor might be designed for a little bit different placement of the electrode. So it's really important to make sure that you're familiar with the type and brand of Holter monitor that you're placing, and that you are placing the electrodes in the correct place, and also instructing the patient on that as well, because oftentimes these electrodes will come off or need to be replaced. You can send the patient with replacement ones, and as long as they have the diagram and they are competent, they should be able to reapply it in the correct way to continue their monitoring. Typically, you'll have them keep a diary. There we go. So the patient diary, they should document all activities and emotional states, and specifically with the time that they experienced it. Any physical symptoms experienced during activity should be indicated next to the activity, and then the recordings are compared with the diary to determine if that activity or emotional state or symptom, it correlates or corresponds with anything on the EKG tracing. So if there's any abnormalities, it's very important to note if they are related to the activity or the symptom or the emotional state. It's also very helpful to know if they are not. Okay, oftentimes people will be having symptoms that are unexplained, and you might have a Holter monitor just to rule out any cardiac abnormalities. So that's also very important information to note, and can be very reassuring for a patient that even though they're getting chest pain, there's no abnormalities on their Holter monitor corresponding with that. Now, that doesn't mean necessarily that they're not going to do any further tests, but it can be reassuring sometimes for patients. So here's a sample diary. The person at 7 a.m. took their medicine, had no symptoms. 7:30, ate breakfast, no symptoms. And then driving to work at 8 a.m., they were probably in traffic, so their heart rate sped up and felt fast to them. And then at 9 a.m., they met with their boss, and their heart felt even faster. They were probably getting palpitations. So it's not surprising, but it's important to then be able to look at the tracing at the corresponding time and see if there was any abnormalities there. And here's another diary with the time, activity, and the symptom. So patients should participate in normal everyday activities unless prohibited by a physician or by a provider. And this can determine their heart function during a normal day. So most routine activities can be performed, except those that could damage the monitor, such as showering, bathing, or swimming. Water. Those monitors are not waterproof. Also, they want to avoid any vigorous physical exercise that could cause excessive sweating, because that can loosen the electrodes. And it can also cause artifacts, handling or removing the monitor from the pouch, or touching or removing the electrodes or the lead wires. They should not use electric blankets, hair dryers, electric shavers, heating pads, microwave ovens, or an electric toothbrush, because these can all cause electrical interference artifacts on the tracing. If a lead wire detaches from an electrode, they should snap it back on as soon as possible. That's pretty easy. They just snap on and off. And then they should record the information in the diary so it doesn't look like a pause or a abnormality on the tracing. If an electrode comes loose, they can press down around the edges of the electrode and re-adhere it. They can also put tape over it, apply tape to restore the contact, like this patient has done, and then recorded the information in the diary. And if the electrode comes off and cannot be replaced, they should contact the office to see what should be done. But typically I send patients home with additional electrodes to reapply, as some of them get worn and cannot be re-adhered. So additional activities to record in the diary, again, physical exercise, walking, housework, gardening, employment-related activities, going up or down stairs, also periods of inactivity, such as lying down or sitting in a chair. Those can cause your heart rate to drop, so it's important to note what's going on at that time. Driving, smoking, urinating, and bowel movements, meals, especially caffeine and alcohol, sexual intercourse, and anytime you take your medications, as well as when sleeping. That's important to note as well. Patients should also record emotional states in the diary, such as anger, excitement, anxiety, fear, and laughter. And they should always report symptoms such as shortness of breath, chest pain, neck, arm, or face pain, palpitations or racing heart, skipped beats, nausea, vomiting, dizziness, faintness, anything like that. Definitely important to note, as well as any additional symptoms. Some Holter monitors have an event marker button, and this is used along with the patient diary for correlation and evaluation. So the patient should be instructed to depress the button when experiencing a symptom, and then this flags the tracing and records that point in time on the tracing, and then they should record the time and nature of the symptom in the diary. So again, depressing the button places a signal on the recording and highlights it when the patient feels a symptom. So the interpreting provider, it's helpful for them to be able to go right to that point in time and decide if the patient's symptoms are having concurrent EKG abnormalities or not. So tachycardia is an abnormally fast heartbeat, but toothbrushing can also look like ventricular tachycardia, which is quite dangerous and can be deadly. So while wearing a Holter monitor, the patient must record in their diary when they're brushing their teeth. Otherwise, it can look like they were having VTach, which would be major cause for concern. So at the end of the monitoring period, the Holter monitor will be removed, and sometimes they may be coming back into the office to have it removed, or they can remove it themselves and then return it. And then the information on the card is uploaded to a computer. Now, so this can be done in the office if the office has the specialized software to upload it and then review it. So the software will perform calculations on the data and prepare an EKG summary report. This is reviewed and interpreted by the physician, along with the patient's diary for comparison with the abnormalities any present. And then this can be printed out and stored in a paper-based record, or it can be stored electronically in the EMR. So some companies even have a direct interface with EMR so that it goes directly into the patient's chart. Sometimes this can be outsourced, just as a side note, that because all of this, 48 hours or even 2 weeks of data has to be, it actually gets reviewed by a technician, usually by a EKG technician, and they help prepare the summary report for the provider to interpret. And unless the clinic has somebody with those capabilities, this is often outsourced. At PAMF Cardiology, we have a couple companies that we work with, iRhythm being one of them, that they actually take the monitors. The monitors get sent directly to them. They extract the data from the monitor directly, and then they prepare the report and send it to the cardiologist for interpretation. So at the end of the recording period, you're always going to want to remove the battery, and these actually get discarded because we don't ever want to worry about using half-used batteries. And then also you never leave the battery in there because it can damage the monitor and the batteries can corrode. I don't know if you've ever seen that. When you leave batteries in toys and stuff, it can get that white crusty stuff on it. That's corrosion. You're going to clean the casing of the monitor, the cables, and the lead wires using a soft cloth moistened with a mild disinfectant, and clean the snap of each lead wire with alcohol to eliminate any electrolyte gel. And these get stored in a dry, dust-free area. These are pictures of the wireless monitors that we often use. This one right here is the one provided by iRhythm. It's called a Zeo Patch monitor. This is another one called the Pix. I actually haven't seen that in person. But these are really handy because they are wireless. And once they're adhered, after usually the initial 48 hours, they've got a pretty good stick on there, and you can actually take a brief shower with them or work out and maybe sweat a little bit. But the idea is that you get these applied for you, right? A technician applies these so that it's done correctly, and then the patient has a bit more freedom than those traditional Holter monitors with all the wires and the electrodes that come off and on easily. And then these just stay on for as long as they will stay on. So they typically come off, anywhere between 10 and 14 days, but it also depends on the patient's skin and how much they're sweating, and if they're more oily than others. And then when it comes off, they usually they come with a box that's already stamped and self-addressed to send back to the company for the company to analyze the data and then provide the report. So these are really handy devices. Sometimes you'll hear them called Band-Aid monitors because they kind of just look like a big Band-Aid. And they do have that event button on them right here. You can press on it and it will mark the tracing, just like we showed on the other one. Okay, that concludes the introduction to Holter monitoring.